And joining me now is the Secretary of Health and Human Services, Tom Price. Thank you very much for being with us, Mr. Secretary. Thank you for joining us.
Thanks, Andrea. Thank you so much. Good to be with you today.
Well, good to be with you. Let's talk about the health care bill as it was passed by the House. The president promised that he would take care of people with pre-existing conditions. Critics say that this bill, as passed by the House, does not.
No, I think it's absolutely true that the president is fulfilling his promise to the American people, and that is to make certain that every single American has access to the kind of coverage that they want for themselves and for their family, not that the government forces them to buy, and make certain that we ensure that individuals with pre-existing illnesses and injuries and conditions are covered, but covered in a way that they want. Again, not that Washington forces them.
But you're talking about access. Access at what price? Are you pricing people out of the market? 84% of people 55 years and older, according to your department's own studies, have pre-existing conditions. Are they going to be able to afford the price that is set? Because states can opt out, and there will no longer be any requirement that this be affordable.
No, absolutely. We think it's going to be more affordable, as a matter of fact, Andrea. But it's important to look at the people that we're talking about. If you have Medicare, if you have Medicaid, if you have insurance through the VA or TRICARE or through your employer, none of this affects you in the pre-existing illness or condition discussion that we're having. If you do have a pre-existing condition and you're in the exchange market right now, remember that many, many people have increasing premiums, increasing deductibles. They're in an area in this country where there is either one insurer offering coverage or in some places none. Those are folks that have pre-existing illnesses and injuries and can't get any care at all. They may have an insurance card, but they can't get care.
But Mr. Secretary,
this is a system that's not working for patients, and that's what we're trying to fix.
I didn't mean to interrupt, but let me just stipulate. There are areas, we know that in Iowa, now in Virginia, that there are insurance market issues. That could be fixed, but let's stipulate that that still needs to be fixed. But what about this issue of pre-existing conditions? You have 22 major healthcare groups. We're going to scroll the names. Let our viewers see. 22 groups, including the AMA, you're talking about the doctors, the American Lung Association, the American Osteopathic Association, the Academy of Pediatrics, the Children's Hospital Association, 22 groups, the AARP, nurses, even insurers, all of them are against the way the House passed this bill. Are they wrong?
Well, what I believe they're not recognizing is that this is a different and we believe a better way to cover individuals with pre-existing illnesses and injuries, because it allows for every single person to get the access to the kind of coverage that they want. Look, nobody wants folks who have a pre-existing illness or injury not to be covered. We want to make certain that we can do it at a lower price and broader choices for patients so that, again, they're able to see the doctor that they want to see, they're able to go to the hospital that they want to go to the clinic that they want to go to, not that Washington forces them to participate in. So this is yes, it's a different way, but it's a way that we believe to be better and more comprehensive and ability to have those patients have the kind of coverage and care that they want. And just because we stipulate that there are places where there's only one insurer or no insurers, that's a major problem, and those are the kinds of things we're trying to fix.
But you say that people are not going to lose what they are getting now. Well, let's take a look at what you said on Fox Business on Friday.
Under Obamacare, the older folks and sicker folks could pay 3 times more than the younger folks, whereas under this plan, they might pay 5 times more. That's going in the wrong direction.
Well, it's pricing for what individuals' health status is, and that's important to appreciate.
So you're raising the costs on the sickest people, the sicker people, to pay for the people who are healthier.
No, what we're trying to do is to make certain that every single person has health coverage. Remember, there are 20 million people right now in this country who have said to the federal government, said to the previous administration, nonsense, I'm not going to participate in your plan. I'll either pay a fine through the IRS or I'll get a waiver. That's 20 million individuals who don't have coverage, and we ought to say, why don't they have coverage, and try to fix that. The fact of the matter is that if those individuals who are sicker, who are older, who are poorer, they will get larger subsidies so that they're able to gain the kind of coverage that they need and want for themselves and for their family. Our desire is to make certain that we have a system that works for patients, not for government, not for insurance companies, but for patients. That's the goal.
Well, we looked at the map, and we looked at the states with people under the age of 65 who have pre-existing conditions. The highest rates of people under 65 with pre-existing conditions are in states that voted for President Trump. What do you say to your own voters?
I say to them, and the president has an absolute commitment to make certain that they have the kind of coverage that they want. Look, this is a different way to do things. There's no doubt about it. We believe it's a better way because it puts patients and families and doctors in charge of health care, not Washington, D.C. This is a change in how we would manage to allow for individuals to gain the kind of coverage that they want. We understand that. And sometimes change can be disconcerting to folks. And that's why I would suggest that list of groups that you had up earlier say they now oppose it. The fact of the matter is they're not focusing on the kinds of things that are going to improve the system for patients and families and docs, not make it so that government or insurance companies are in charge.
Well, let's talk about women. I mean, when we looked at the Rose Garden and the celebration of this on Thursday, they were mostly all men and white men at that. There was no diversity there. Women's health issues arguably are going to be disproportionately affected. Take a look at this. Obamacare includes maternity and newborn care, preventative care, mammograms, cervical cancer screenings, birth control, all of this under the essential package, no longer required under this House bill.
Andrea, come on, look at that picture. Congresswoman Diane Black, the chair of the Budget Committee, I was standing next to her. Seema Verma, the administrator of CMS, I was standing right next to her.
Out of a group of dozens and dozens of people, you can cite two or three women?
These are prominent individuals who are leading in this area of health care. But the goal, as I mentioned, is to make certain that every single American, men, women, rich, poor, old, young, have the kind of coverage that they want for themselves and for their families, not that government forces them to buy. That's the change.
Well, let's talk about not only women, but also what the president promised. I wanted to play for you what the president promised about Medicaid during the campaign.
There is a percentage, a fairly large percentage, that can't afford it. Then those people don't get taken care of. That's wrong. We're going to take care of that through the Medicaid system. We're going to take care of those people. We have no choice. We're not going to let people die on the streets.
Medicaid expansion is going to be cut in the first version of this bill, and there's no CBO score because they rushed it through before getting the accounting from the nonpartisan Congressional Budget Office. But the first version had $880 billion cut from Medicaid. That goes right against the president's promise not to cut Medicaid.
No, what it does is say that there's a better way to do things. Imagine a system, if you will, where if you have insurance through your employer, but you fall on tough times and you fall into the Medicaid market, that transition is seamless. Imagine if you go the other way, from Medicaid to employer-sponsored insurance, that transition is seamless. Imagine that you go from Medicaid to the individual market or the exchange market, that transition is seamless. Right now, there are huge holes in these things. We don't want to pull out the rug from anybody. We want to make certain.
With all due respect, you found $880 billion. Isn't this just another way to come up with the close to $1 trillion? The president actually said as much on Fox Business. You're finding almost $1 trillion in savings in order to be able to pay a tax cut that is revenue neutral.
Andrea, in the Medicaid system right now, 1 out of every 3 physicians in this nation who ought to be seeing patients in Medicaid are not. We ought to, as a society, ask ourselves, why is that the case, and fix that. The Medicaid population is basically 4 different demographics. It's seniors, it's disabled, it's healthy moms, and kids. And what the federal government now stipulates is that those healthy moms and kids need to be cared for in exactly the same manner as the seniors and the disabled. That doesn't make any sense to anybody. So what we're trying to do is to improve the Medicaid system, make it more responsive to patients so that there are more resources to be able to be utilized for the disabled and the aged. That makes a whole lot of sense.
I think a lot of people will wonder how taking more than $800 billion out of something is going to put more resources in it. But let me ask you one final question about health care. The Office of Drug Policy, Drug Control, the White House office is being decimated, according to one proposal. 90% cut. Why eliminate the White House Office of Drug Control at the very time when we have an opioid epidemic in this country?
This is a budget that hasn't been completed yet, but what I will tell you is that the president has an absolute commitment to making certain that we fight the opioid crisis. It's one of the 3 top priorities that I've identified for the Department of Health and Human Services. We were able to put out $485 million in grants to states just 2 weeks ago. I'm moving around the country this coming week to go to states where we want to make certain that they are allowed and have the resources to be able to address this opioid crisis. This is an absolute scourge in our country. 33,000 deaths last year due to opioid overdose. We cannot tolerate that. And the Department of Health and Human Services, along with the President, have this as an absolute priority. Now, whether it's through an office within the White House or whether it's through a department, an agency of government, I don't think the American people care. What they care about is that we are absolutely addressing this opioid crisis in the most aggressive and effective manner possible.
Mr. Secretary, thank you very much. We'll have to leave it there. Thanks for being with us today on Meet the Press.
Thanks, Andrea.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and then click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.